So my name is Chuck Bransford. I'm a general internist and palliative care physician, and I practice out in Stillwater, Minnesota. Stillwater, Medicine. And I'm a traditional allopathic doctor. So how many allopathic physicians are there here? Could you just raise your hand? Actually, quite a few. Yeah. I have 2 articles that you'll be able to read that's in the syllabus, and they were written for Minnesota physicians. And the reason I did that was I was trying to get our Western doctors to get a sense of what's going on here, and I hope that you'll enjoy them. In 2006, I went to India with Mim and the group, and got to experience directly what the Tibetan doctors have been talking about here. When you go into the Menzicon and you go into this hospital, the feeling there is one of friendliness, openness, and there is no ego that I can see. Children roam the halls freely. When you go to the pharmacy, there's usually a kid sitting with the pharmacist counting out the pills. You know? When you see some of the older patients and they're in their equivalent to the hospice, literally they would start to giggle as their doctor came. You know, just a total bout of giggle. You could tell they were so excited to see their physician. And for me to observe that was just open heart, open mind. You know, to experience that, and I thought to myself, that's what I want to be when I go back. I want to be able to do that. In the Delic Hospital, I saw the same thing. They do great work. The C-section rate at the Delic Hospital is 1%. Ours is approaching 25%. So that in itself tells you a lot. We could learn a lot there. In this panel, what we want to do is we want to talk about what we're doing in the here and now that would be from Tibetan medicine and being applied to our present practice. And so for me, what happened to me was when I came back, I'd always wanted to do hospice and palliative care. It was my dream, but I didn't really know how to do it. I didn't quite have the courage, and I didn't really know if I could handle it. And so watching the Tibetan doctors kind of gave me the clue as to what I needed. And so when I came back, I got my second specialty, a subspecialty in palliative care, and have been practicing that ever since, and it's been a life-changing experience for me. I work in a hospice, and I am the medical director for the hospice, but then I also work in the oncology clinic. And that's maybe what's unique for my situation, is I get to see people when they're first diagnosed as well as when they're sick. And when someone is first diagnosed with cancer, they kind of go through a kind of a personality meltdown. You have to kind of rebuild their personality. And to be there with them and watch them do that is one of the great gifts of being a palliative care physician. And what you realize is that it's not you. It's these people. They have the ability. They have the internal structure, the strength. It's just that they've kind of forgotten it or they've lost it. And so you can sit there and watch them and help them create meaning out of their life. And that's what palliative care has been for me. And truly, I think it is the essence of Tibetan medicine. I just feel that way very strongly, that if I said, what is Tibetan medicine in our system, it's palliative care. And palliative care is growing, it's getting stronger, it's very inexpensive. You know, we don't do a lot of tests, we just kind of try to help people with their symptoms, that's what we do. So it's an exciting place that I think is changing, and I think you'll see a lot of that in healthcare. The second thing for me was that I started practicing yoga, very specifically, started to meditate, and we started doing mind-body groups through our hospital. And we will do one per season is how we do it. And we will work with people who have cancer. We'll work with people who just want to learn about it. And we'll teach meditation, guided imagery, yoga. But as I've learned over time, what we're really trying to do is to teach people to have their own skills to find their own health for them. And we kind of culminated in doing what's called a life map. And probably a lot of people know what life maps are. And when a person does a life map, they're kind of drawing on their inner resources to kind of let you know and let themselves know what it is that keeps them strong and makes them strong. And the life map is sort of the culmination of our program, and it is really fun to watch people come alive. So those are kind of the two things I would say that have changed in my life, and I'm ever grateful to the Tibetan doctors and the India program, and thank you very much.
My name is Alejandro Chaul. I'm not a physician. My PhD is in religious studies, in Tibetan studies. I got inspired in Tibetan medicine, actually organizing the first visit of His Holiness, the Dalai Lama, to South America. And in one of the times that I got to be with him, he said that Tibetan medicine is a great way a non-violent way to bring Dharma also to the world. And that was an inspiration. And at that time, I wasn't sure what that meant for me, not being a physician. And then going into the world of academia and being in Tibetan studies, I realized as I was doing my PhD that I was across one of the largest medical centers. Actually, as a friend of mine says, the largest medical center the world has ever seen, which could be good or bad. As John Kabat-Zinn, when he was speaking there, he said it's also a big magnet of suffering, right? So the area that I work with is the area of humanistic medicine, as Dr. Sadhu Tsang was saying, an important area that we're bringing now to our medical schools. But also another area of integrative medicine, and particularly the mind-body practices that we've heard the importance of them in Tibetan medicine. I was happy to hear the president of the university here talk about how meditation has an impact in healthcare, something that we know, but it was impressive to hear it from him. Something that His Holiness, of course, has been promoting from years for long, maybe at least over a decade, of not only dialogues, but essentially research in these areas. So one of the areas, as I started in 1999 at a cancer hospital at MD Anderson, I started with clinic or meeting with different patients and their families. But soon after that, with the help of behavioral researcher, Dr. Lorenzo Cohen, he said, what about doing research? What about doing clinical research? And I said, it sounds fascinating, but I have no clue what you're talking about. But basically, he said, why don't you do a mind-body intervention? Still didn't make much sense. But basically, he said, well, do a program that could be made for our cancer population. So I said, okay, let me get back to my teachers. So I went back to my teachers, Lopon Tenzin Namda and Tenzin Wangyal Rinpoche from the Likmincha Institute, from the Bern tradition, and we created the first Tibetan yoga protocol for the first study that we did was with lymphoma patients. So I'll briefly, in the 5 minutes I have, I'll briefly talk a little bit about some of that research and some of the conclusions and maybe way to look into the future. So as I say, in 1999, we did our first pilot study, was with lymphoma patients, both men and women with Hodgkin's and non-Hodgkin's lymphoma. And basically, we designed a protocol for a randomized controlled trial. So we're trying to do kind of the golden standard of the West and trying to see how this Eastern practice could fit for these people that were either in active treatment or 12 months after their treatment. And so we did a year of a pilot study with 44 patients, kind of half and half in the treatment or in the intervention, mind-body intervention, the Tibetan yoga, which is Tsa Lung, right? And we heard the word lung, and we heard the word also lung in terms of, from Dr. Tandrin, of the 5 kinds of lung. And this kind of Tsa Lung, actually each movement is related to a different kind of lung. And again, I don't have much time to go into that, but basically it's very much related to Tibetan medicine and how to balance our lung. And so we did this study, and this was in 1999 to 2000, and we got it published in 2004 in Cancer Journal. And just kind of the summary is that the main significant outcome was sleep. Sleep quality, sleep quantity, sleep latency, which is the moment you want to go to sleep until you actually go to sleep, and less sleep medicine. So after that, we moved to a breast cancer population, and especially women with breast cancer. And we did the same trial. And we also had, at the beginning, actually, when we were looking at the results, we couldn't find the same results. And we were saying, kind of scratching our heads. And then as we looked at subpopulations, we realized that those women undergoing chemotherapy were more benefited from the treatment, from the Tibetan yoga intervention. And so as we looked at that, we found significant factors, outcomes in the sleep and also anxiety and quality of life and something we call intrusive thoughts. And so we applied for a larger study. So in 2006, as actually I was finalizing my, my PhD, my defense on, it was actually my dissertation was on Tibetan yoga and applications with cancer patients. So we got a grant from NCI. We got a $2.4 million grant to look at this Tibetan yoga for women with breast cancer undergoing chemotherapy to reduce anxiety and sleep disorders and to improve outcomes of quality of life and mental health. That study is undergoing, and in January we finished the recruitment. It's 300 women, 100 in each arm, 100 in the Tibetan yoga intervention, 100 in stretchings that are similar to the Tibetan yoga, but coming from a stretching manual for breast cancer patients, and 100 in standard of care, which I was sorry to hear when I entered the field 11 years ago that standard of care means nothing. But we can talk about that in another time. And then after that, we did one more study. So basically, after January, we'll have some more information and see where we go with that. One last study that I wanted to mention is a study with Tibetan sounds that were used with women with breast cancer undergoing chemotherapy that had cognitive deficiency, what sometimes we call chemo brain. And we just finished the pilot study with 43 women in this study, and we just presented it at the American Psychosomatic Society, so it's not published yet. But basically, the main outcomes were improved in short-term memory, improved in executive function, and improved in spirituality. So we look forward to applying for that for a larger grant. So in conclusion, these are some of the few actually Tibetan mind-body practices that are used in a cancer population and certainly in a randomized control trial. The programs were actually found to be feasible for patients, and they find the programs acceptable and actually a very positive experience. And we had some indication of efficacy, so we hope to see more of this in the future. We have started including it in the clinic, both in groups, and actually we started a meditation clinic. So actually, you can see more. We have a website that should be online also in the THI website, and it's mdanderson.org/CIMER, Complementary Integrative Medicine Educational Research. Take a deep breath. And you're welcome to contact me from there. And I hope that we also have more collaboration with Minnesota and with others. Look forward to expanding this field with compassion. Thank you.
Oh, thank you.
July 20th and 21st of next year, we're going to do a Tibetan yoga workshop here in Minnesota. And
excellent.
More to come.
Yeah, good. Hello, I'm Georgia Milan, and I'm so incredibly honored to be here today. And I've been integrating Tibetan medicine into family practice in this country for about 20 years. And I do not have near the skill level of some of these incredible Tibetan physicians here. But what inspired me to study Tibetan medicine was working with Tibetan physicians. And like the previous speaker said, that it's important to remember compassion, because when people think of Tibetan medicine, we can get lost, you know, in the lists, in the constitutions, in the food, and certainly in some of the herbal medicines. And it's so important not to get lost in that. That's very easy to learn. But the main thing is that all of you here, you know, by purpose of you being here, you know, it is your karma. You obviously have the great capacity to be a provider of Tibetan medicine, or you would not be here. And so that means that each and every one of you is full of not just the potential for compassion, but truly compassion in action. And it really brings tears to my eyes because looking around at everyone, especially because we're living in very negative times, and there's been a lot of prophecies from Tibetan medicine about some of the illnesses that we're seeing right now and some of the mental disturbances. And it's a very, very difficult time. It's a time when things really are quite upside down, and it's a time of a lot of mental afflictions. And so when I look around this room and I hear these incredible people who have spoken, it brings such confidence to me that I am surrounded by this compassion. And working with Tibetan medicine doctors, they never say, no, I don't want to see the next patient, I'm too tired. Excuse me, I want a lunch break. Do they have insurance? There's none of that. And, you know, truly, as we wake up every day, we say, may I embrace my karma for today, knowing that every patient that comes into this room is our chance to purify our karma. And the only way we can do that is, you know, the medicine Buddha, all of us here take this very seriously because we all have our own kinks, we all have our mental conceptions that are not true, we have our angers, our desires. But truly, as we leave that behind on the doorstep and we truly emanate the medicine Buddha, then none of that applies anymore, and truly our interest is in the best interest of this patient. And it's so important, these medicine Buddha mantras, but to always have that in our mind, because if we can do that, the rest of the Tibetan medicine, that will come easily. But it's the habitual patterns of our minds, because that is what our patients want from us, right? They want us to help them with their habitual patterns of the mind. They may not know that. I mean, most patients who come to see me have no idea that I even practice Tibetan medicine. I mean, they're there for their high blood pressure, and they are all suffering, and they all want happiness, as was said. And we know the causes of suffering, and they are so happy to talk about it. They are so happy to learn meditation, and we may use other terms than that. But they know their suffering, they know their anger, they know their desires, they know they're stressed. In fact, I often give speeches on the shocking science of stress, you know, as a way to kind of wake people up. Because people don't want to be so stressed out. People don't want not to sleep. They don't want to be depressed. They don't want to be anxious. You know, I work in a lot of other countries where there's great physical suffering, but often very little mental suffering. And then I come back to this country where there is very little physical suffering and great mental suffering. You know, it is amazing to me. And so this is one of the main things that I work with the people who come to me about, is this mental suffering. And I use different language that feels right to them. The other thing I wanted to point out that is so important with Tibetan medicine is living in balance. And these are concepts that are very easy to learn. There's times that you eat, there's times that you go to bed. You know, with our electricity, we can stay up all night long. But if you live in accordance with the laws of nature, then nature can be our guide. And we have so forgotten that right now we have 85,000 toxic chemicals in our environment in the United States. Only 200 have been tested, and the majority were not here 100 years ago. That the average baby who is born in the United States, if you only test for 350 toxic carcinogenic chemicals, the average baby has 250. And this is our karma. And so we have to look at nature. In the name of human health, we are killing our planet, and we can no longer do this. You know, we look at our culture spending $85 billion a year in supplements, and if we ate right, if we had strong digestion, if we lived in compassion, we could feed the world many times over. And so these are some of the things that I think about a lot as I practice medicine. And one of the last things I'll mention, I know it's time to move on, is that I do talk about impermanence, and I do talk about death. This life is so precious, and it's so fleeting. It's over so quickly, and we are so busy that we miss it. You know, I tell my patients that if it is true, like many religions say, that when you die, you get to see a movie of your life, for most of us, it will be the first time we've ever seen it. You know, it's like, oh my God, where was I? Well, I was thinking about yesterday or tomorrow. It's like, oh, wow, this is kind of an exciting film I'm seeing. And you know, we have to stop missing it because this is our one precious opportunity. And so I'm grateful to all of you for sharing this opportunity with me. And I thank very much Mim and the speakers for allowing me to be here. So thank you.
My name is Yang Bomjel. I'm a bacon person, but no, my lung is high. Just having 5 minutes to talk about my whole practice, my lung is no high. Okay, and actually I did study Tibetan medicine in Tibet and worked in Tibet, and then I came to India, and the education of Tibetan medicine in Tibet and India is totally different because of the system in Tibet. We were not allowed to learn about the spiritual part and the spiritual practice, and only the technical and the mechanic part. And when I came to India, so in India you can learn everything, you can practice everything. And so I learned many. And now I work in Madison, Wisconsin, and Charaka Integrative Center, Charaka Center for Integrative Medicine. I work with MD, who is a doctor in family medicine, and also I sometimes work with Dr. Soyapurs. He's here, and he's also a doctor in family medicine. And so what I do when I see a patient in my clinic, I do intake, and I have a form, questionnaire form, and also consent form. And in questionnaire form, so asking about the age or different questions. And sometimes I do need 2 hours for one person, sometimes 1 hour, because here people don't know anything about Tibetan medicine, and I have to explain from the head to toe, and then the person have many questions to ask, and it's okay and taking longer, and but the person need more information, need to know what is Tibetan medicine and what it does, how it effective, how is it safe to take, and so after all, and nothing also. The most people who come to my clinic, probably 90% are women, and also say 90% Americans, and maybe women more also have a kind of interest learning new things, and also they have more kind of care and curiosity about other kind of modality of the healing and the medicine, and also another part also they care about their family and looking for another kind of treatment. And so I always say to mothers, because mothers are most important or center of the family, and the mothers like mother of goddess, and if mother is not healthy physically, mentally, everyone in the family is not healthy and not strong enough. And so some people also, then I also, because we are what we eat, we are what we do, and we are what we think, most probably due to improper diet, improper lifestyle, and improper thinking. And so I do kind of individualized, personalized assessment, and more talking about personal life. And some people not that open, kind of keep away and revealing their kind of personal life. But to have a precise kind of assessment and diagnosis and treatment, personal life is very important. And so first time, maybe some people not that open, but the second time, oh, thank you, doctor, and you saved my life, and I'm here again. And so that makes me feel very happy and satisfied. And so that is also what I do. And Another thing also, like Tibetan medicine now here, many people and this conference getting kind of more attention and awareness. Like in the 70s, Dr. Yeshi Tuandeng, who is the former private physician to His Holiness, he came to the US first and made some tours in US, and that was the first time, and that one doctor came to here, and then Dr. Tenzin Cheta, he came also in the early 80s. So that time also, one organization in New York made a kind of, arranged a kind of workshop and later to see some patients, but someone came with a hidden camera and so took the picture of, as a video and so did talk about the AIDS, and doctor himself didn't say Tibetan medicine can cure the AIDS, but someone made that up, and because the hidden camera, and made that available in the national television. Then he had to run away. And now that's different situation. Now here are many people and many MDs and nurses and kind of getting momentum, and so this is very important. And so now also you see here we in North America there are around 60, 70 Tibetan physicians. Some of them do practice Tibetan medicine, some of them not. And because people don't know about Tibetan medicine here, Tibetan medicine is new here. And so there are a lot of work needed to be done. Because another thing also, lack of literature in English on Tibetan medicine, not many translations. And like Chinese medicine, there are many, many, many literatures, English, available in Chinese medicine, and or many schools there. So there's a way to also educate people and train people here as a Tibetan doctor, and so that's very important. And now here also the university just starting, this kind of conference, and the Tibetan Healing Initiative is also one kind of first step to go into this direction. And so I want to thank Miriam and the Center for Specialty and Healing for organizing this conference, and thank you very much.
We're going to take some questions now. Thank you guys for staying on the 5 minutes. That was about the most difficult thing I've ever done. Well, since I'm the moderator, I get to ask my first question. And actually, this comes, so when we were in Dharamsala, Tenzin was our doctor. And as we were going along the road to Dharamsala, which means, by the way, home of the Dharma, home of the truth, as we're going along, it's 17 hours. And we're supposed to get there in about 12. And Tenzin figures out as we're going along that the drivers are purposely going in the wrong direction to avoid certain places where they might get taxed. And so Tenzin was starting to get angry, but a Tibetan can't get angry. Really. So instead, what I saw, and I really saw this, was that Tenzin was kind of becoming physically ill. Kind of before my eyes, I would say. And so my question to the panel is, how do you deal healthily with anger after it's arisen? Not before, not prevention, but what do you do once it's there? It's an easy question.
Well, actually, I think, I mean, since I work with mind-body practices, you know, that's where I would work with. In a way, anger, irritation has to do with also what I sometimes call or what in Tibetan they call kind of the monkey mind, right? And so kind of calming the monkey mind, in a way, kind of bringing it down more here, and when you bring it here, also cultivating loving kindness and compassion, and knowing, really understanding why they're doing that, and relaxing a little more. So that sounds, again, very simple, but through exercises of meditation, it's one way. I'm not saying the only way. It's one way.
I think that's a great answer. You know, anger is something that is so ubiquitous. I mean, we all get angry. And so I think one way to deal with anger is just not to react to it too much. It's kind of like, gee, I'm really, really mad. Or someone else is really mad, but then we put so much, we get so afraid, or what's wrong with me? I'm mad, or I shouldn't be mad, or all of this. It's kind of like, well, if there's anger, then there's anger, and it will dissipate. So, of course, there's a lot of physical things that one can do with it, but I think the main thing with anger is just not to get caught up in it, not to make it a drama. So what? You're angry. It's just a shmoo. It's not a monster, you know? So anger, I haven't seen you for at least an hour. Come on in and have tea. So that's what I do.
Yes. Yes, to deal with the anger, and first we have to know the cause of the anger and the root of the cause of the anger. And after finding that, of course, we need, also the shiwatsu and the chunji, because we all get anger because of due to the some change in the friendship, financial, health, family issues, personal issues, do get anger easily, and then because sometimes we can change everything, and so in Chunji it's saying saying that if we can't change something, there's no reason being unhappy, and if we can change, but there's no reason being happy too, and so first we need to find the cause of the anger, and then need to deal with that.
So I was thinking this question was related, but not quite. It just sounded like, can you use Tibetan medicine in veterinary sciences?
Veterinary science, yes. One thing also, Dr. Rinpoche, the elder brother of His Holiness Dalai Lama, who passed away a few years ago, and he is very fond of dogs. And he also actually did get a Lhasa Apso from 13th Dalai Lama. And so when he was in, he did live in Bloomington, Indiana. I was there for many years, and he did have very big 4 dogs. Not the German Shepherd, but very big, like the Tibetan, that kind of dog. And so he normally gave Rinchen Rubo, precious pill, Rinchen Rena Sampa, to these dogs. But the dogs were very strong, never been ill, and that also, yes, applicable, I think.
You know, and animals have, of course, each has their own constitution. I was crazy enough to get a Lung horse one time, which really taught me some lessons. But, you know, animals as well as plants have their different constitutions. So everything in nature has their constitution. And so if one knows how that can live in balance, or the antidotes, keeping it in balance, it's very helpful.
And the other part of that is, what does TM say about being a vegetarian?
Being a vegetarian in Tibetan medicine, this is also depending on the individual's constitution. Because there are many people, also I know some people who are vegans, changing their diet, and before they were non-vegetarian, they do eat meat, and they do use also milk, cheese, butters. After some time, they change that, and only vegetables and fruits, and no milk, no cheese, no meat, of course. And then they do get many kind of health issues because they were non-vegetarians, their body based on proteins from the meat. And when we change that suddenly, then also constitution also change. Then also the pathogenic of this nibas, lung tipa bacon also change, and one become more dominant. And the people we have different lung tipa bacon. If a lung person to become a vegetarian, that's not beneficial. And because lung people more need protein-based food, nutritional-based food. And maybe bacon is okay. And sativa, sometimes okay.
One thing just that's interesting is that in the American diet to be healthy now, we're eating lots and lots of fish. And this was not done in Tibetan, traditionally, certainly in Tibet or Tibetan medicine, because to eat millions of fish, that's millions of lives, millions of sentient beings. Whereas if you're going to eat a yak or eat a cow, then one animal can feed many, many, many people. So again, in the name of human health, we've almost outfished the entire oceans of the world. So we have to be very careful what we're doing in the name of human health. So, so now everyone's eating fish, everyone's eating chicken instead of eating beef that could be natural, organic, and feed a lot of people. So Tibetan medicine looks at things in a more comprehensive way.
So the next question, I think, is for me. It is, why do you think most allopathic oncologists are so resistant to including palliative care docs in the care team early in the diagnosis? I did not write this. Any suggestions for increasing palliative care consultations in my institution? I don't know what institution that is. I really think that is changing dramatically. I can tell you that 10 years for sure ago, oncologists did not feel that palliative care physicians had anything to offer and just got in the way. Because they felt like, basically you would encourage patients not to take chemotherapy. That was really the concern. As time has gone by, I think that they all have seen the value of a palliative care physician. In my institution, I work very closely with our oncologists, and we have a great relationship together. We talk about treatment plans. It's really integrative medicine at its best, I think, and I do not feel any resistance there. In fact, I've learned a lot from the oncologists because there are a lot of times when I thought a patient really should stop treatment, and I was wrong. So it goes both ways. But I think there is a great mutual respect there, and there's now the first study that shows that a palliative care physician is as good as second-line chemotherapy for lung cancer. It takes that kind of study, it's kind of crazy. I'm thinking, well, am I as good as second-line chemotherapy?
Let me just add, too, in my center, in MD Anderson, one of the things that I was sharing with Charles before is that the whole area of palliative care is now being called supportive care. And it's trying to be, so to get the palliative dogs, or now the supportive doctors, actually early on, as soon as the patient is diagnosed, get them on board. So the caring goes together with the curing. And I think this has changed dramatically. And I think in that study also, they've shown that beneficial. So I think that is a trend that it's not just at MD Anderson. I think it's in other hospitals and healthcare centers.
Thinking about the intense training for Western medical students, how can the concept of balance be introduced on the educational academic level to allow our practitioners to foster greater balance? We should just offer another course in Tibetan medicine.
Actually, I work in the medical school. One thing that we have in store, and it was actually from the medical students, is especially first year, that it's such a stressful time, to do a meditation class. And so every Monday, and I missed it today, but I had someone doing it instead of me, at noon we meet. And it's not that the whole medical student population comes, but the few that come actually have they report incredible changes in how they can cope with medical school. And so that's the disease for them. But the other thing that was interesting that happened was that now staff and faculty said, what about us? And so now we get a lot of faculty and staff as well. So I think that's one way, again, of bringing some little kind of drops of balance in their medical school.
Yes, and just, the bigger picture, certainly as a society as a whole, I keep trying to remember the view that, we are a very Lung-driven culture. We move very fast. We like lots and lots of stimulants. We have the illusion of productivity because we're on the run all of the time. And so the way we practice medicine is a reflection of the whole culture. And so we, again, need to take ownership for that. When, at the time that I started studying Tibetan medicine, I had been with Indian Health Service for 10 years, and I was with the Shoshone-Bannock people, and they are, the earth people in Sanskrit, it'd be Kapha or Began in Tibet. And it was very interesting because, they're trapped in a Lung culture, and they're very disrespected, and they should be very, very respected, and they're not. Then they're given all this Lung food that they're supposed to be eating, and so they suffer from a lot of heart disease and diabetes, diseases that they've never, ever had. So I did a lot of work with the elders and the medicine people looking at what would be a Began lifestyle, and it was exactly their traditional, the bitter, the astringent, the pungent. In fact, their herbs that they use traditionally are for a Began people, not for the Lung people who are now trying to use a lot of the Native American herbs because we have forgotten. But it was interesting because they very much are caught in this culture that's such a Lung culture that they're supposed to go to the factories, they're supposed to be working, they're not supposed to be living their traditional ways. And getting back to medicine, that we need to remember that as a culture, how we're raising our children, how we're eating, how we're sleeping, that we need to be changing the whole culture. And of course, the healers need to be healed, there's no doubt about it, but the examples that we give and what we demand from the companies that we work for, the type of time we have with the family, the time to actually eat and digest our food, and the time to pray, the time to meditate, it needs to be pervasive, it needs to be everywhere, it needs to be in the medical schools and residency, and it needs to be in our homes, and it needs to be every place we work all the time.
In Tibet, I did study medicine in Tibet. Also, that time in my school, very small population of Tibetans do show interest in studying Tibetan medicine. And nowadays in Tibet, every different region have a school teaching Tibetan medicine. And also now in India, also previously in the 60s, 70s, there were very less people do show interest in studying Tibetan medicine, and now there are more kind of demand student enrollment in the medical college. And so here, one thing also, when we think about medicine, everyone's mind comes mainstream medicine, conventional medicine. And the second, probably Chinese or Ayurvedic. There's small kind of space in their brain about Tibetan medicine. And one thing also, because in the states, different states have different kind of regulation to rules, and some states have very more kind of open or loose kind of regulation rules on the complementary alternative medicine, and some states has very very strict rules and regulations on given license and certificate like that. And so in Indiana also I did teach Tibetan culture, Tibetan medicine at the Indiana University, and many people, yes, faculty and graduates, and showed interest studying Tibetan medicine. And also in Bloomington, medicine in Wisconsin, or the University of Wisconsin, and there are also graduates and faculty members, and do show interest in studying Tibetan medicine. And also nurses and also MDs also do show interest, and so now it is becoming kind of more well-known and getting more attention.
In our hospital and clinic system, we do a couple of things because stress doesn't end after medical school. Every time a baby is born, we play a lullaby, and you can just see people just kind of taking a deep breath. If they're twins, we play it twice. Our clinic president reads a poem once a week over the intercom to the physicians. It's part of our ritual, and it's amazing. I don't think there's ever been a time when I haven't wanted to delete it, to move on, I'm too busy. But every time I stop and listen to that poem, it brings back why I practice medicine, and it's a wonderful thing. The third thing is that if you teach meditation, there's nothing more challenging than trying to do it over a noon hour in a hospital. But it really gives you a sense of, how much stress people are living with, and I would encourage you to try to do that because it's sort of the place when we need it the most. So those are kind of the three things that we have tried to do. Also, just one other thing, when we did one of our mind-body groups, Tenzin Nandal came to it, our Tibetan doctor, and he said afterwards, he says, it's really interesting. People actually talk about their meditation life. We just do it. There's a question about death and dying and how Tibetan medicine might help in the world of death and dying, and I thought maybe I'd ask that to the group.
In Tibetan medicine also do talk about death and dying, and when someone's reach or near about dying, and so that Parto Tuto and Tibetan book living and dying, and so that also used, and then also the when the consciousness leave the body, then the body become useless, and so the person dies, and so before also before the moment of dying, and also do read other of religious scriptures, and also do bring a lama, and do also do pray and chanting and ritual, and am I answering the question?
Yeah,
Okay.
I think so. Yeah.
Yeah, and then also because we all talked this morning and this afternoon, Dr. Tandon and Namto all talked about the 5 element. So 5 element also responsible for forming the body, and when the forming the body, and also the responsible for the treatment, and also responsible for the sensory organs, and every sensory organs outside is does correspond to internal organs. If something wrong inside, it shows outside of the sensory organs. So if someone dying, also the step by step 5 element dissolve into the next element. So that way, first the vision, then the hearing, then the smell, then the touch. Gradually, the body becomes decomposed, and then also consciousness leave at last from the crown. And that kind of, because one thing also we all know, everything is permanent, change momentarily, and so body also change and every moment, and so no one can avoid dying and the disease and birth. And one thing difference in between Chinese medicine and the Tibetan medicine, there's a philosophical difference. Chinese medicine also based on the Taoism and Confucian, and that also seek immortal, never die, never change. But the Tibetan medicine is impermanent and change every time and momentarily. So that also Tibetans do believe our body is impermanent. So keeping that in mind, and also do meditate on dying, and when the day comes, so there's less people have fear of dying, and less worry about dying, and then also the consciousness leaves body on time, and also body also. Yes, people, high lamas, masters who do control their mind and the consciousness. So as Dr. Tsetan said, that some lama, their body do not compose for 1 week, 2 weeks. So that happens. Thank you.
I do think we have a lot that we can learn from our Tibetan colleges about death and dying. I think, in our culture, I think what happened was that after World War II, our parents were so sick of death and dying that they hid it from us. And so we have a whole generation that has no experience with death. I'm afraid that's where we are. And they were trying to do us a favor, but it was not a favor. And so we have to kind of relearn that, and that's where the hospice movement is coming from. When I see patients now, I will tell them that I think they're dying, and they have no sense of it. They don't have an internal sense that they're dying. And I believe that Tibetans do. I think there's a big difference, and we're going to have to relearn that. I'm not sure how we do that, but I think that's part of our job going forward. I was thinking about my training in death and dying at the University of Minnesota. It was 0. So my first dead body was, of course, the cadaver. That doesn't count. But I was an intern at Hennepin County Medical Center. It's 3 o'clock in the morning, and the nurse calls and says, I want you to come and pronounce this patient. Okay, and I come and I see the patient lying there in the bed, and I think, he looks dead. But I'm not sure. And I thought, should I hold a mirror up to his nose, see if he's breathing? Do I check for reflexes in the eyes? And I'd just seen a Quincy episode where a person was in a phenobarb coma, and Quincy figured it out, So I kept going through all these machinations, and I listened to the heart, and I listened to the lungs, and the nurse looks at me and says, he's dead.
Just ask the nurse.
We can only go up, right? Yeah, it's amazing. So.
I think this is a very important topic, and actually, again, as you mentioned, something that is being hidden from us. And for me, it was very difficult when I started teaching cancer patients and bringing the topic of impermanence, that on one hand, I felt almost like a talking head. These were people that were facing it much more there than me, although I could die at any moment too. And actually being able to bring that was very interesting because most people were actually very welcoming to talk about death, especially the patients, not so much their families though. And so I find that both in hospice, in palliative care, but even in general in the hospital at any stage, talking about impermanence and understanding that impermanence, it's not something like something where we lose the battle, but actually a possibility of change and a possibility of reconnecting to something that we've been kind of hiding for a long time. I decided to take kind of a leap of faith, if you would, and started talking with the patients about it, and the majority of the times, it was amazing how grateful they were that someone actually was talking about death and impermanence, and that it actually helped them in thinking, well, I'll try and live every moment the best I can, because I know that I could be dead the next day. But also, from my side, it was a very great learning experience, and also knowing that it could happen to me too. We don't have to have cancer to do that. And actually, what science is telling us is, look how much it doesn't matter what disease. I mean, you can live so much longer now with all science. So it's a good balance. I think what I like to say, it's kind of medication and meditation are a good couple.
The one thing, just one quick thing I'd like to say is that we need to start teaching about death and dying at very early ages, because what happens is we wait till someone is often very caught in fear, anger, denial, and their families are also caught in the same thing. And so during the dying process, often people are way over-medicated, and they're over-medicated more because of the family. But you see the patient struggling with consciousness at such an important point. It's kind of like the most important time of our life is our death, and yet we do almost nothing to prepare for that. It's almost like that should be mandatory from kindergarten on, death and dying, and this is what you do, this is what you expect, that, yeah, this is all going to happen. And so as a culture, we need to kind of move that at a much earlier age because it's going to happen to all of us. And there you have it.
There are a lot of questions related to how do I get in touch with a Tibetan practitioner, Is there any insurance coverage for that or yoga? And I think maybe we can try to answer those after the session because I think we're.
It's going to be on the website about it's on there now.
Okay.
About the practitioner's contact information and bios.
Okay. Yeah, so there'll be contact information and bios for all the Tibetan practitioners on the website. So that'll be there. That should be a good thing. About time to.
Not covered by insurance.
Of course, nothing's covered by insurance. Yeah, but we will try to prior auth you. Thank you.